Hello, this is Dr. Tomassini from Spine and Performance at Corrective, and today I'm going to be talking about pelvic unleveling, especially lateral pelvis unleveling. So what happens is that your pelvis is misaligned and that will throw you like this. So that's lateral pelvic unleveling. You're going to have one pelvis bone that is higher than the other one is lower, and usually what happens is rotate. So one goes back, one goes forward, and that will throw you like this. That happens when you sit for long hours, when you cross your legs a lot, when you sit on your wallet or anything on your back pocket, and when you sleep on your side like this, okay, instead of having the pelvis neutral, okay? Now, how do you know if you have this condition? Well, pretty simple. You're going to stand in front of the mirror and you're going to go over your ribs and then go down, 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 down till you find your pelvic bones right there. And then you're going to see if you have one higher than the other one, okay? And then you know which one is higher, which one is lower. Now I'm going to record some exercises for you to stretch the muscles that are tight and strengthen the muscles that are weak to improve this condition. But really important for you guys to know that it's important to align the bones of the pelvis and the lower back, and that's done with a chiropractic adjustment. So first we're going to start with correcting the muscle imbalances, okay? Usually I do this after I adjust your pelvis and adjust your spine to improve the mobility, but you're at home, I can adjust you at home, so we're going to do it like this. Okay, so usually you have one side that is higher, one side that is lower. In this case, we're seeing the patient from behind, and the right side is higher. In that side that is higher, you're going to have a tight Quadratus lumborum, that's a muscle that goes from the ribs to the pelvis. A tight psoas muscle, that muscle goes from the spine to the front of the hip. A tight adductor muscle on that same side, adductors. Weak glutes and weak hamstrings. On the opposite side, you're going to have tight glutes muscles, especially glute medius, glute minimus, and maximum around that area, and tightness on the hamstring. So we need to stretch the muscles that are tight and we need to strengthen the muscles that are weak. In this picture right here, you see it again. On the side that is higher, you're going to have a tight quadratus lumborum, a tight adductor muscle, and a tight gluteus minimus and medium. Okay? So let's start with the stretches. The first exercise is to stretch the psoas muscle. The psoas muscle goes from the lower back, cross, and goes to the hip. So from the lower back to the hip. So remember that on the side that you have the higher side of the pelvis, this muscle is going to be tight. But either way, you're going to stretch both, okay? But always do more repetitions on the side that is tight. So let's say I'm going to stretch my right side. I'm going to go like this. And I'm going to bring my leg forward, okay? Till I feel a stretch on this area. As soon as I feel a stretch in that area, I'm going to bring the pelvis a little bit back, bringing the pelvis back. To get a better stretch, I'm going to raise my hands together, look up, and hold that 15 to 20 seconds, and I can go to the side as well. So that's how you stretch the psoas muscle. If this is too much for you, what you're going to do, you're going to lay down on your side and you're going to pull your leg back to feel the stretch on the side. Okay, so that's for the psoas muscle. In this next exercise, we're going to stretch the Quadratus lumborum muscles. This muscle goes from the pelvis up to the ribs. Okay, when it's tight, it's going to bring that pelvis up. So what you're going to go for a pole or a frame of a door. And if I'm going to stretch my right side, what I'm going to do, I'm going to bring my right leg behind my left leg, trying to put it against the frame of the door, and my hands like this. And I'm going to stretch that Quadratus lumborum. If I'm going to stretch the left side, what I'm going to do, I'm going to go parallel with the frame of the door, put my left leg behind, as close as possible to the door, put my hands like this, and pull. And you're going to hold that for 15 to 30 seconds. Another thing that we can do to loosen up the Quadratus lumborum muscle and work on the psoas as well is with a tennis ball. You're going to put it against the floor or the yoga mat, and you're going to go for this area right here where the muscle goes from the pelvis to the spine and the ribs, and you're going to put a ball and you're going to look for knots on that area and move up and down. When you feel a spot that is tight, put some pressure right there. That's for the QL, the Quadratus Lumborum. If you're going to work on your hip flexors, psoas muscle that goes from the lower back and up to the front of the hip, you're going to put the ball on your front of the hip and look for a knot on that area and put some pressure. This might hurt a bit, but it works. To stretch the adductor muscle, what you're going to do is you're going to most likely just put your leg like this and go down, and you will feel the stretch on this area. You can put the leg on a wall, you can put the door on a frame and just go down, or you can put it even on the floor and just go down and twist. Okay, you feel the stretch on the adductor muscle. You can work with adductor muscle with the ball, or you can do it with a foam roll as well. That helps to loosen up all that area. Now for the glutes, you can use the ball as well, or you can use a foam roll. If I'm going to use a foam roll, what I'm going to do is cross my legs like this, and I'm going to roll all my glutes and all my piriformis muscle. If you don't have a foam roll, what you're going to do is get a tennis ball and look for knots on that muscle as well. When you find one that is tight, press on it 10 to 15 seconds and release that muscle as well. Remember that on the side that is high, you're going to have a tight Quadratus Lumborum, a tight adductor muscle, a tight psoas muscle, and you're going to have a weak glute and a weak hamstring. On the other side, you're going to have a tight hamstring. So how are we going to strengthen the hamstring and the glute? Well, simple exercise. You're going to do a one leg bridge. So let's say I'm strengthening this one. What I'm going to do, I'm going to straighten this leg, put my hands like this, and I'm going to go up and down, up and down. And I want you to feel it on the glute. Sometimes you will feel it on the hamstring as well. Do 15 repetitions, 3 to 4 sets, and that's how you strengthen that area. In this next exercise, we're going to be rocking the pelvis side to side, up and down, okay? So what we're going to do, you're going to get a stepper. If you don't have a stepper, you can put some books. Make sure that they are not too slippery. And you're going to stand on the books with one leg, okay? And with the other leg, you're going to leave it straight and you're going to bring it down. You can bend the knee a little bit and go up. Stretch that leg down, bring the pelvis down, and then bring it up. Down and up. And then, to show you the opposite side, same thing. Stretch that leg. You can bend this knee a little bit and then bring the pelvis up, and then stretch all the way down and bring it up. Okay? And this exercise, this is one of the best exercises that you can do for your spine and for your pelvis. It's called cat and camel, or cat and cow. And what you're going to do is go on all your fours, bring your pelvis and your spine up like this, and then bring your spine down and the head up. You're bringing here pelvis anteriorly, and when you go up, you're bringing your spine up and your pelvis posteriorly and the head down. Very simple to do at home as well. One of the main signs that we see when you have lateral pelvis unleveling is leg length discrepancies. You might have one leg that is shorter, you might have one leg that is longer. Usually, how I see this is you're laying down, facing down. I look at the feet and the malleolus, the ankles, to see if they are the same length. In her case, the left side, the leg is shorter, and when I check on the pelvis, when I push here, I see that the leg goes a little bit longer. So in her case, the pelvis is going back on the left side. This is her leg very shorter, and that's the area that I'm going to be adjusting. Okay, now I'm going to adjust the left side of her pelvis. This is a side that is going back. This is called a rotation, posterior rotation, or PI. Okay. Of the pelvis. I'm going to look for pelvis right there. I'm going to cause a little bit of obstruction with my hand, and right there. That's the adjustment. Another thing that we can do to improve that is wrap the leg, look for the contact spot of the pelvis, and push it up and forward, so anteriorly and superiorly, and at the same time I'm stretching the psoas muscle. Remember that muscle that I told you that was tight. Okay, so you hold that position, that's it.